Good night, everybody. 8 and 1. Well, it's your choice if we start or we maybe could expect a little bit or wait a little bit for your classmates. Please let me know your opinion now.
Good night. I think we can wait a little bit more.
Okay, maybe 5 minutes.
Yes, I think it's not a problem to me.
Okay, let's wait until 8 and 5, 3 minutes more, and then we start because there is a very long presentation. And we only have 1 hour to get in class, okay? So 3 minutes more and then we start. Okay, let's start. 8 and 5, I think it's enough time to expect for your classmates. And as I was telling you, this is a very long presentation because we have lots of topics to check today. So let's go. Please, questions tomorrow during the workshop, okay? All the questions, prepare all of them. And as you know, I'm gonna send the PDF file with this presentation at the end by the Zoom chat. Let's go. Today, we are going to have a general view about the respiratory system, heart and circulation, urinary system, and gastrointestinal system. About the respiratory system, we know that this is the network of organs and tissues that help you breathe. It includes your airways, lungs, and blood vessels. The muscles that power your lungs are also part of the respiratory system, of course. These parts work together to move oxygen throughout the body and clean out waste gases like carbon dioxide. These include the nose, throat, larynx, trachea, bronchi, and lungs. Also called the respiratory tract. I mean, this is a synonym, respiratory system and respiratory tract. Both of them are allowed, okay? Our red guy, this is our first anatomical review. When we have the chance to check the anatomical big details, I mean non-small ones, in order to not get complicated and catch the most common and most important vocabulary at this point. So read this, check the vocabulary, and according to this information, we are going to check homework during the weekend. Another slide with similar anatomical landmarks, just for making a comparison about the common vocabulary that we can find during the medical information throughout the networks and books, of course. And now the first X-rays, checking the anatomical details we must look for during these studies, image studies, right? Easy to check, I think, very familiar to the ones that are doctors. So take it in count in order to practice, to check the vocabulary, the anatomical landmarks, the details, how to express these details. For example, the cardiophrenic angle, the costophrenic angle, the right and left hemidiaphragm, the gastric bowel, the liver, trachea, carina. So easy to check, right? Let's practice on this. Let's check all of these details. Let's go with this first chart, the overview of structures, combining forms and functions. Of course, functions are for you, for checking at home all the specific vocabulary, making a description of every major structure. Take it in count, please. It's very important. As major structures, we have the nose, related combining forms, nas or naso, sinuses, sinus or sinuso, pharynx, pharyngo, larynx, laryngo, epiglottis, epiglotto, trachea, tracheum, bronchi, broncho or bronchio, alveoli, alveolo, lungs, pneumo, pneumono, pulmono. Okay. Well, the word parts the same. You know the word root, the suffix, and all the details. Making a review again with the meaning for catching easily what we are talking about in the medical term. Let's go with some interesting pathologies, interesting details. For example, the upper respiratory tract infection, the URT. A URT is an infection of your upper respiratory tract, of course. This includes your throat, nose, pharynx, larynx, sinuses, and trachea. Trachea is also called windpipe. This upper portion of your airway is susceptible to many bacterial and viral infections that can cause a range of symptoms with varying degrees of severity. Infections and airborne illnesses are easily spread by contact with other people and are often transferred by sneezing or coughing. We all know about it, about the epidemiological basis. We know about contagious diseases. So let's take it in count in order to understand how it is going on. This chart is showing us the most common symptoms about the URT. The most common ones for catching the vocabulary, okay? We have sneezing, chills, headache, sore throat, airborne infection, of course, cough, cold, backache, and snot. Very, very common situations. I think we all have suffered all of the symptoms. That's why we can get in contact and get it easy to catch the meaning, okay? About cough, of course, is a common symptom of an URT and a lung disease. A cough may be productive, where the patient coughs up sputum, or non-productive, where there is no sputum, of course. A productive cough is often described as loose, and a non-productive cough as dry. A sputum or phlegm may be clear or white. It's called mucoid. Yellow due to the presence of pus, purulent, or blood-stained, as in hemoptysis. Hemoptysis, I'm sorry. We have this conversation between a doctor and a patient. When a doctor is examining a patient who's complaining of cough. I need two volunteers who would like to read this. One is the doctor and the other one is Mr. Hamilton.
May I?
Of course. Can you tell me your name, please?
Andrea.
Okay, Andrea. One volunteer more, please. Andrea and, well, let's make it easy. And Misael, are you there, Misael? Okay, I'm taking count. Any other volunteer, maybe? One is Andrea, I need a second one.
Maria, teacher.
Okay, perfect, Maria. Andrea, you are the doctor, and Maria, Mr. Hamilton, okay?
Okay.
Let's go ahead.
How long have you had the cough?
Oh, 4 years.
Do you smoke?
I used to smoke. See you, teacher.
I'm sorry. I used to smoke.
Yes, I used to smoke heavily, but I gave up years ago.
Do you cough up any phlegm?
Yes.
What color is it?
Usually yellow.
Have you ever noticed any blood in it?
No.
Any problems with your breathing?
Yes, I get very short of breath. I have to stop halfway of the stairs to get my breath back.
Thank you so much. Thank you both. So you can see in this conversation, the doctor is asking about symptoms, about complaints, and the characteristics of each one of every complaint that the patient is describing. At this point, the doctor got some information to make his notes. And that's the way we write down patient's case notes. Ceaseless show, complaint of dyspnea and cough. Weight, that's the abbreviation of weight, purulent sputum for years, no hemoptysis. There's an example how all of this information is written down like a resume, just medical information, just medical terms in a very small note, right? Not too much information, not mentioning all the negative data that the doctor is receiving from the patient, right? The non-phlegm, well, this is a pronunciation tip. is phlegm with an F. pH always like an F, okay? So consider this patient case notes and all of these conversations with the blackened words in order to take the expressions that the patient is using for expressing ideas and how the doctor is making questions. This is our first approach in order to get this kind of information. Well, just an advice, cover your mouth when you cough. Of course, we all know about it. And this is an information slide that, talking about snot, you have some different colors, right? We all know about it. Read this slide, check this information, and according to this, take vocabulary we're talking about. I mean, specific words and expressions describing medical situations, or maybe giving an answer about what the situation is or how the situation is going on. It's very important to take it in account, okay? It's for you. About phlegm, we all know that according to the color, we have some specific characteristics, the same as in snot. If it's white, green, red, or brown, we have specific situations to support and specific details to look for during the medical exam. In white, may mean allergies or viral infection. We all know about it. Green may mean bacterial infection. Red may mean lung injury or malignancy. And brown may indicate a lung disease. We all know about it, okay? Just for checking a review, maybe catching a new word in this slide. What about common cold? Well, of course, it's an infection that affects your entire upper respiratory system. A virus attaches to the lining of your nose and throat and triggers an immune response. This immune response results in a congestion in the local area and leaves your body feeling generally run down as you try to fight it. Most colds are caused by the rhinovirus, but other culprits included influenza, parainfluenza, and coronavirus. Check these blackened words in order to get the specific words to memorize during this class, okay? Some symptoms, of course, blocked nose, sneezing, sore throat, dripping mucus from your nose, stuffy feeling, fatigue. With a common cold, we usually don't go to take a medical appointment or don't go to the emergency room because we know that it's going to pass away without any trouble in a few days. That's why we decide to use at-home cold remedies, right? Of course, ways to fight the common cold. We use descongestants, only adults only. Antihistamines, again, adults only. Saltwater gargle, okay. NSAIDs, adults only. Plenty of fluids, of course, hot tea. The Vaporovia, just as an example. Lots of rest, zinc lozenges, echinacea, and maybe a warm bath, according to the place you are living at the moment. Just for checking vocabulary, take this in count, okay? Maybe we have some other at-home remedies, but just for information, okay? For catching more expressions. During our job, talking about specifically to the respiratory systems, of course, we have to develop the auscultation. We have to listen to the sounds of the body during a physical exam. This method, of course, is developed by a doctor, okay? Maybe by nurses, maybe by another healthcare providers looking for specific details, and that's great. We use the stethoscope, and according to that, we have the chance to listen the lungs, heart, and intestines or bowels. They are the most common organs heard, right? Let's come back. Let's check again, Mr. Hamilton. The doctor is examining Mr. Hamilton's chest, the one that was in the previous dialogue, right? The doctor says, take deep breaths and in out throughout your mouth. Good, now say 99. We all know that making these maneuvers, we have the chance to improve the sounds of lungs while the air passing away through the respiratory tract and then hear clearly. And during this practice, we make, well, at the end, of course, we make our notes. Again, we have an example of the notes. OE means on examination, on physical exam of chest in this case. It says early inspiratory crackles, both lungs bases plus expiratory wheeze, right? As you can see, they are not describing all the maneuvers, not all the details, just going to the positive facts. If there are negative information, I mean normal information from the patient, it's not necessary to write down in a note, just the most important details in the physical exam using abbreviations. Listen to the chest with the stethoscope, maybe reveal the presence of sounds, of course, apart the normal bird sounds. There are two main kinds of added sounds, the crackles and the wheezes. Crackles, which sound like hairs being rubbed together and suggest the presence of fluid in the lungs. And wheezes, which are more musical sounds like wrestling, and indicate narrowing of the airways. The sound of asthma patients breathing is also called wheeze. These website links I'm going to send to the group at the end of the class in order to hear the fine crackles and wheezes. Some examples to practice hearing and catching the idea from this presentation. Okay. The sound heard when the pleural surfaces are inflamed, as in pleurisy, is called a pleural rub. Again, we have a link that I'm going to send to the group. Don't worry about it. The pleural friction rub, a loud grating lung sound that is heard when inflamed pleural rub together, that is caused by decreased fluid in the pleural space. Okay. While saying 99, we know that the doctor is asking Mr. Hamilton to check vocal resonance, which may be increased as in pneumonia or decreased as in pneumothorax. We have this chart checking this information and some sound patterns in order to check the differences. Okay. So taking it in account just as an extra information could be a good idea for picking up more vocabulary. Now, in this slide, we are checking the breath sounds, how it works in an schematic way, how the sound could be translated in a picture during the inspiration and expiration. We could check the duration, expiration, allocation. That's why it's in colors. Please check it at home and try to get as much vocabulary as you can. Some vocabulary abbreviations, of course, we can talk about it tomorrow, okay? Because of time, we cannot read all of these slides, detailed ones, because they are extra information. Just try to consider this information in order to catch vocabulary. The same with the abnormal breathing sounds. We have stridor and the place it usually is produced, ronking, pleural friction rib, crackles or rails, the squawk, and wheezes. all of them with its characteristics, with anatomical positions. Check them for catching more vocabulary just, okay? And now this is a very important slide, I think, in my personal opinion. It's just for checking the respiratory pattern and possible causes. Of course, we have the eupnea, the normal respiratory pattern. We all know about it, and all of the pathological sounds, bird sounds, with an schematic line, we can say, and the probable causes of them. Some pathological situations, the characteristics of this. We have bradypnea, tachypnea, hyperpnea, Kussmaul, hypopnea, ataxic, biot, Cheyne-Stokes, air trapping, obstructive, sighing, apneusing, agonal, apnea. Okay, check all of this, read the causes, please, for catching more vocabulary about pathologies in general, as a general view, and the patterns, okay? It's for you. And then let's check the pathology of the respiratory system. This is a big chart. This is the first part. About the lung diseases, we have the COPD, chronic obstructive pulmonary disease, asthma, acute respiratory distress syndrome, the ARDS, atelectasis, pulmonary edema, pulmonary embolism, pneumorrhagia, tuberculosis. Then we have the upper respiratory diseases, the URI or URT, allergic rhinitis, croup, diphtheria, epistaxis, influenza, pertussis, rhinorrhea, sinusitis, pharynx and larynx, pharyngitis, laryngospasm, voice disorders. For example, aphonia, dysphonia, laryngitis, trachea and bronchi, tracheorrhagia, bronchiectasis, bronchorrhea, pleural cavity, pleurisy, pleurodynia, pleural effusion, pyothorax, empyema, hemothorax, pneumothorax. Then we got the pneumonias, named of the affected lung tissue, for example, bronchopneumonia or lobar pneumonia. And the pneumonia named of the causative agent. We have all of this. And the interstitial lung disease, the pulmonary fibrosis. Again, interstitial lung disease, the pulmonary fibrosis, and the environmental and interstitial lung diseases, pneumoconiosis, anthracosis, asbestosis, silicosis, the genetic disorders, cystic fibrosis, lung cancer. About the lack of oxygen, we have the airway obstruction, and nausea, hypoxia, attitude hypoxia, asphyxia or asphyxiation, cyanosis, hypercapnia, hypoxemia, respiratory failure, smoke inhalation. General view of them just for catching the vocabulary and maybe pronunciation of all of these situations. Check all of this, please, very important. We have this chart for information, again, showing you a chart, how it is going on about pneumonia, asbestosis, pulmonary fibrosis, details like that. And in an emphysema, how it looks, right? You could see how the alveoli is destroyed. In that way, we have the chance to find the meanings of this. Abbreviations, again, the common ones, just for practicing, for checking this information. You have the ARDS, chronic bronchitis, Jenny Stokes breathing. So you have the chance to check all of this information, okay? Practice on this. Very important in my opinion, very common while writing down. So let's take it in count. Talking about the cardiovascular system, the heart and circulation. Well, we have the definition. It's made of blood vessels that carry blood away from and towards the heart. Arteries carry blood away from the heart, and veins carry blood back to the heart. The circulatory system carries oxygen, nutrients, and hormones to cells, and removes waste products like carbon dioxide. We all know about it. Checking the anatomical reviews, of course, is for taking in account at home. Just information, general information. I made a great report for looking for just in English definitions, anatomical landmarks. So take it in account, check all of this, and tomorrow during the workshop, we have the chance to practice on the pronunciation of all of these structures. As you can see, there are a lot of slides with this, but it's important to consider that there is a lot of vocabulary to take in account about the heart and the vessels, okay? Just as an information, not for evaluation, we have the blood flow through the heart. For taking into account more vocabulary, it's for you, taking into account if you consider it necessarily. And then again, a general view of the circulatory system, okay? And then a very important chart, the arterial veins, well, the arteries and veins, both diagrams, both charts for checking the most important structures as a general information, okay? Maybe a little bit of detail for taking into account how to talk properly in specific cases. Again, just veins and arteries in this case, the most important for making a contrasting picture from the previous one. About the overview of structures combining forms, we have some major structures, the heart, cardio and cardio, blood vessels, angio or vaso, arteries, arterio, capillaries, capillo, veins, phlevo or veno, and blood, hemo or hemato. Again, the word parts, we know how to recognize them. The word root, the prefix with the hyphen at the end, the suffix with the hyphen at the beginning. Check this list again with the meanings for making a contrasting idea, I think, and then make it easily to construct the medical term. And let's talk about specific situations. In this case, shortness of breath. Shortness of breath or breathlessness is the meaning of dyspnea. At first, it's caused by exertion, physical activity such as climbing stairs. But in severe cases, it may be present even at rest. A patient who is breathless when lying flat, orthopnea, for example in bed, will tend to sleep raised in 2 or more pillows. The abbreviation SOVO stands for shortness of breath on exercise, or on exertion, or on effort, according to the situation. Patients usually say, I get terribly short of breath climbing stairs, right? About the heart rhythm, we have some ways to give these expressions, okay? The normal resting heart rate is 65 to 75 beats per minute, as an example. That's the abbreviation for beats per minute, BPM. In athletes, it may be as low as 40 beats per minute. You can develop old expression. In extreme athletic activity, the heart rate can go as high as 200 beats per minute. Similar to Spanish, right? The heart rhythm may be regular or irregular. Okay, so take it in account in the order how we are showing the abbreviations to write down this value. Again, we have this schematic check, taking into account the sounds while auscultation, just for extra information, none for evaluation, okay? Just for checking an interesting detail, I think. In an irregular rhythm, the arrhythmia may be early beats, which interrupt the regular rhythm, the premature beats, or the rhythm may vary with respiration, or it may be completely irregular, as in fibrillation. When patients are aware of irregularity, they describe the symptoms as palpitations. They use this expression to express, to say, for example, they say, I feel palpitations, because they're talking about an arrhythmia. A similar situation than in Spanish. It's for taking in account. This is a clinical case. This is the way we can show some extra information for practicing. And let's read this. A 22-year-old student was admitted to the hospital with a long history of heart problems. He has been increasingly tired, with shortness of breath on exertion, with SOO, orthopnea, and palpitations. A mitral valve replacement has been carried out 3 years previously, and this had stabilized the symptoms of heart failure, but was followed by episodes or attacks of atrial fibrillation, which had been particularly severe for the 6 months before admission. So you can see a patient with heart failure, right? Some symptoms about the heart disease, of course, shortness of breath, chest pain, nausea or vomiting, I mean feeling sick, heart attack is the last, anxiety, sweating, and dizziness. Taking into account all of this information, okay? Let's talk about the heart failure. It occurs when the heart is unable to maintain sufficient cardiac output, the amount of blood pumped by the heart each minute, for the body's needs. It may involve the left side of the heart, the right side, or both. We all know about it. Could be right heart failure, left heart failure, or total heart failure. Some charts, just as an extra information to check the physiopathology of this situation, how to support every symptom of this. None for evaluation, just for checking the extra information, okay? And we have this. The symptoms of right heart failure included peripheral edema, the swelling, okay? Beginning in the feet and ankles. This is known as pitting edema. If, when a finger is pushed into the swelling, it causes a small depression or pit. That small cavity while making depression, we get this, and according to how high it gets, we have the chance to organize the edema classification, right? So taking in account this new expression, feeding edema. About the examination of the heart and circulation, we start with the inspection. Look at the lips, tongue, and nails for the blue declaration of cyanosis. We were talking about it. Cyanosis may be central or peripheral. We all know about it. Here we have some examples, central and peripheral. Then we have the claving. We check the claving in hands, like this shape. We all, I think, in my personal opinion, I'm not sure if you had the chance to check this, but during the medical career, we always find the patient with these fingers, right? For making the physical exam, we must check pulse, right? And we feel the radial pulse at the wrist and note the rate. For example, 70 per minute, and rhythm, regular or irregular. And the pulse may be irregular in forces as well as time. Check the other peripheral pulses are present. We have on this chart all the pulses we can check. Okay, techniques, maneuvers, of course, we know. We have the information about it from the medical school. About the blood pressure, the BP, when assesses the jugular venous pressure, the JVP. About this, we have always to evaluate this. And if we check an increase in jugular venous pressure, we have the chance to infer that something is not going well, of course. It has its own maneuvers, so take it in account. We palpate the chest for the apex beat. The normal position is in the 5th left intercostal space, 1 centimeter medial to the mid-clavicular line, right? Heart disease may be measured by percussion. We all know about it. The heart size, okay? Check this chart to catch the correct positions for auscultation and the percussion and palpation. Feel for any trills, listen for murmurs and other abnormal sounds. For example, friction rubs, beginning at the mitral area. Murmurs may be soft or loud. A harsh murmur is loud and raw. We all know about it. We have this, we have this chart, the abdomen. It's an acronym, it's an example how to memorize, how to practice our medical terms in order to check the symptoms that we must look for or the causes like this case, and then make a good diagnosis. Just as an example for you, not for getting into evaluation or homework. And let's check the pathologies of the cardiovascular system. A very, very general review about the heart, congenital heart defects, coronary artery disease, the CAD, atherosclerosis, ischemic heart disease, myocardial infarction, heart failure, carditis, cardiomyopathy, heart valves, cardiac arrest and arrhythmia, atrial and ventricular fibrillations. Blood vessels, abnormalities, we have vasculitis, angiostenosis, hemangioma, hypoperfusion. About the arteries, aneurysm, arteriosclerosis, arteriostenosis. Talking about veins, chronic venous insufficiency, phlebitis, varicose veins. About thrombosis and metabolism and embolisms, thrombotic occlusion, coronary thrombosis, deep vein thrombosis. About the peripheral vascular diseases, peripheral occlusive disease, Raynaud's disease. How about the hypertension? We have essential hypertension, secondary hypertension, malignant hypertension, hypotension, and orthostatic hypotension. Just for showing you some pathologies, some general, very general information. And again, we have the chance to check vocabulary with abbreviations. As you can see, there are some more because these ones are supported that the system, of course, has lots and lots of patients every year. Take this in account because as you were checking your homework, this is the opportunity to become practicing and maybe memorizing the most important ones. Talking about the urinary system, well, we all know about it. We have the chance to see that its function is to filter blood and create urine as a waste byproduct, okay? The organs of the urinary system include the kidneys, renal pelvis, ureters, the bladder, and urethra. We have this first anatomical review, anatomical detail for checking. And then let's go with some details because it's important for us. It's for you. Check all the anatomical landmarks, practice on this because, of course, some of these slides of these charts are going to the homework and maybe to the final test. About the major structures and related combining forms, we have the kidneys, and it changes to nephro or reno, renal pelvis to pielo, urinary to uro or urino, ureters, uretero, urinary bladder, cyst or cysto, urethra, uretro, prostate, prostato. The word parts again with the suffixes, prefixes, and the complete term. The complete word root, I mean. And now we have this patient, urinary symptoms. We have Dr. and Mr. Jones. Again, a new clinical situation to check some big details. Any volunteer who would like to read? I need 2 people. Hello.
Me, teacher.
Okay, give me a second. Who said me? Yes. Yes. Perfect. One volunteer more, please.
I'm here.
Neil, perfect. Okay. Liz, you are the doctor, and Neil, you are Mr. Jones, okay?
Yeah.
Okay.
Let's go ahead.
Are you having any trouble with your weather words?
Well, I do seems to have to go to the toilet more often than used to.
How often is that?
It depends, but sometimes it's very hard hour and even more often.
What about at night? Do you have a get up at night?
Yes, nearly always 2 or 3 times.
Do you get any burning of pain when you pass weather?
No, not usually.
Do you have any trouble getting started?
No,
Is a strain normal? I mean, is there still a good strong flow?
perhaps not quite so good as air used to be.
Do you ever lose control of your bladder? Any leaking or dribbling?
Well, perhaps a little dribblings from time to time.
Have you ever passed blood in the urine?
No, never.
Okay, thank you. Perfect both. Well done, well done, well done. So you can see here we have some expressions, common ways to ask for information, for example, waterworks, and some ways to give the answer with a common expression to go to the toilet, for example. Check this dialogue. Take some expressions that maybe are not clear at the beginning while talking at the first time, and tomorrow we can solve all of the doubts about it. As you can see, it's a very common situation in men that are getting over 60. And well, it's important to take it in account because these expressions are showing us as a pathological situation that maybe we can correct by treatment or maybe in other situations, right? These expressions, for example, is the stream normal or lose control of your bladder, are very, very common, and we have to find this way of expression because these are the ones that we have to translate into the medical term while making our notes, and while talking to the patient, we can go back, right? That's why they're important. Practice on this, and tomorrow we can check this vocabulary. Of course, I'm going to ask from this vocabulary tomorrow, okay? The most common symptoms talking about the urinary system, we have this list and the meaning. Frequency, talking about the urinary system, is the frequent passing of urine. Go to the toilet many times, okay? Dysuria, burning or scalding pain in the urethra when passing urine. Nocturia, urination at night. Urgency, urgent need to pass urine. Hesitancy, difficulty starting to pass urine. Urinary incontinence, involuntary passing of urine. Hematuria, macroscopic blood in the urine. Check this. Of course, it's our blue guy. He's showing us that it's an important slide. We're going to work on this. Common symptoms about a urinary tract infection. We must consider the muddy urine, blood in the urine, or hematuria, frequent urination or frequency, abdominal pain, bad smell of urine, fever, feeling unwell or malaise, burning with urination, the scalding. Okay, take it in count. One of the most important studies, lab studies we make, will ask for in our medical activities, of course, the urinalysis or the synonym analysis of urine. Of course, it's a simple screening test of the urine are carried out with reagent strips. More detailed tests are carried out in laboratory on a specimen of urine. This is the specimen of urine. Typical specimens are a midstream specimen, MSU, the abbreviation, and a catheter specimen, CSU. Microscopic examination may reveal the presence of red blood cells, pus cells, or casts. Casts are solid bodies formed by proteins or cells. Plus signs are used in case notes to indicate abnormal findings. We mean a small amount, 1+, is described as a trace. For a large amount, 3+, the word is gross or marked. Both of them can be used. When there is nothing into the specimen of urine or any specimen during the studies, the word nil is common. I mean, it's like an abbreviation telling us that nothing is there, okay? When we talk about pyelonephritis, a urinary infection at any part, we have some details to check, some pathologies. Pyelonephritis, the ureter infection or urethritis, cystitis, when we talk about the bladder infection, urethritis, urethral infection, prostatitis in males, about the prostate infection. And we know the physiopathology, how it works, right? So just as next information for taking it in count, okay? And our chart, yes, the most common, the biggest chart, pathologies of the urinary system. We have stones, nephrolithiasis, nephrolith, ureterolith, cystolith, ureters, hydroureter, ureterectasis, ureterorrhagia, prostate gland, benign prostate hyperplasia, prostatism, prostate cancer, prostatitis, urinary bladder, cystalgia, cystocele, interstitial cystitis, vesicovaginal fistula, neurogenic bladder, urethra, ureterorrhagia, ureteruria, ureterostenosis, abnormal urethral opening, I mean epispadias or hypospadias. Urinary tract infections, of course, cystitis, pielitis, pyelonephritis, urethritis. About urination, we have anuria, dysuria, enuresis, oliguria, polyuria, urinary hesitancy, urinary retention. About incontinence, urinary incontinence, overflow incontinence, stress incontinence, overactive bladder. Okay, take it in account, just information for practicing these pathologies, okay? And the same, abbreviations for considering the most common ones. All the ones that are in the book that I'm using for preparing these materials. But of course, during the presentation, we were checking some of them, and now we have the chance to check a list that are more specific about procedures, about pathologies. Very important to take in account, okay? About the gastrointestinal tract, I mean, this is the last one from this night. Let's make a small effort, please. I know it's a long, very long presentation. The organs that put liquids and travel through when they are swallowed, digested, absorbed, and leave the body as feces. These organs include the mouth, pharynx or throat, esophagus, stomach, small intestine, large intestine, rectum, and anus. We all know about it. We have our first anatomical landmark to check, to start evaluating our vocabulary. And then we have this slide for homework. Again, for checking at home, memorizing all this. We have the anatomical detail, we can say, and its function. I like it because it has a different expression, right? The gallbladder and its function. Again, so take it in account, read this, catch as much vocabulary as you can. Going to the mouth, we have all the anatomical details, the most common ones, the most important ones, I think. These structures of tongue and oral cavity are very important to consider. And the structures of the stomach, again, just general information, not too detailed because there is no time to prepare this. And the accessory digestive organs, liver, gallbladder, and pancreas. Check this information, okay? Now we have the 9 regions and 4 quadrants of the abdomen, anatomical details for the evaluation, for the physical exam. A review just for being prepared while talking about the physical exam. And then the major structures and related combining forms. We all know about it. Let's read it fast. Mouth, oro or stomato, pharynx, pharyngo, esophagus, esophago, stomach, gastro, small intestine, entero, large intestine, colono, rectum and anus, ano, procto, recto, liver, hepato, gallbladder, cholecysto, pancreas, pancreato. Okay, read the primary functions, please. And again, check the word parts, considering the 3 details: word part, prefix, and suffix. You know how to identify each one. Let's go to the fact, the examination of the abdomen. On inspection, note if the abdomen is distended by fluid or gas, right? We all know how to do it, just check this, right? About the auscultation, listen for the vowel sounds, listen for the intestinal sounds. We know how to make its description, right? Tomorrow we are going to talk about it during the workshop, so don't worry about it. The presence of fluid can be confirmed by demonstrating shift in dullness during percussion or tap. Okay, we all know how to make this percussion. When the patient is lying on supine, flat on their back, then we ask the patient to move and then we percuss again. If the fluid is present, the dull note heard on percussion moves, right? We all know about it, how to make it sound properly. About palpation, each region of feeling of tenderness, pain when touched, or masses palpable arrangement of tissue, right? Not also any wordings or rigidity showing by contraction of the abdominal muscles. The wording may be due to tenderness or anxiety and can be reduced if the patient is persuaded to relax. Rigidity, however, is constant and is due to peritoneal irritation. Rebound tenderness is pain when the palpating hand is suddenly removed. It is a sign of peritonitis. We all know about it. Just checking how to describe it. Right. Talking about feces, almost we always say wakala, but it's important. Why it's important? Because considering its characteristic, we have the chance to infer maybe the pathology that the patient is suffering from, okay? There are several words for the feces. I mean, several expressions. Doctors sometimes may say, there was blood in stools. Or the way we were talking, have you passed black stools? Okay, pass stools is to go to the bathroom, right? And patients may say, my motions have been very loose lately. We were talking about motions while talking about symptoms, right? Motions is the bowel movement and how this product, the feces, are left away, I'm sorry. Bowel movement is also referred to defecation, as we were talking about. And we can say, how your bowels move today? Or we can ask, have you had a bowel movement today? I mean, did you go to the bathroom today? It's the same question, okay? The bowel habit is a medical expression, meaning the pattern of defecation, meaning how the patient passes away the stools. Have you noticed any change of bowel habit? Very important, right? How often do you open your bowels? When we say open your bowels, the same. How often do you pass your stools? Or are you going to the toilet more often than normal? Going to the toilet the same as open your bowels, or the same bowel habit. So consider these expressions. Why we use expressions and not ask rudely, maybe, when like telling, how is your defecation? Of course not, because as I was telling you in previous presentations, some of these expressions may be considered as offensive. especially in Hindi people, during the Black community, and well, some religions that could consider that you are not taking in count their beliefs. That's why using this expression since kindly, you break the ice and it's easy to talk to your patient. Check all of them, okay? For extra information, we have this chart. When we consider the Bristol stool form scale, the Bristol stool, of course, as everything is in medicine, is prepared for evaluating the feces, and according to the characteristic, we have a type, and this type is giving us the key how the bowels are working, maybe. Changing bowel habit could be constipation, hard, infrequent stools, or the opposite, diarrhea, frequent soft or liquid stools, right? Normal stools are brown and in color and semi-solid or formed. The consistency or degree of hardness and softness can be shown on this scale. So according to this, you have the chance to evaluate. Type 1 and 2 for constipation, 3, 4, and 4 for normal, for formed stools, and from 5 to 7, diarrhea, okay? So take it in count. Read all of this information, read the characteristics, the description, and then you're catching more specific vocabulary. Of course, we talk about the color too. The color can vary from black due to an altered blood, as in melena, to yellow, gray, or even white. Melena stools are often described as tarry, like a tar, the black sticky substance that is used in rose making. The stools may be red when fresh blood is present. Blood can only be detected with a special test. It's called fecal cord blood, FOB, right? Again, another abbreviation to consider. When there is a high fat content, the stools are pale and sometimes described as clay-colored. The stools that are large in volume are described as bulky. A bad smell is described as foul or offensive. If you hear or read offensive stools, I mean that the smell is awful, terrible, right? So consider this chart for checking the causes of changing in color and this description to catching the vocabulary in each expression, okay? And now pathologies, yes, the best. Oral cavity, Optus ulcer, cheilosis, herpes labialis, leukoplakia, stomatitis, stomomycosis, oral thrush, trismus, xerostomia, cleft lip and cleft palate, esophagus, dysphagia, gastroesophageal reflux disease, Barrett's esophagus, pyrosis, esophageal varices, hiatal hernia. About the stomach, gastritis, gastroenteritis, gastrorrhea, peptic ulcers, stomach cancer, liver. Let's talk about ascites, cirrhosis, hepatitis, jaundice, non-alcoholic fatty liver disease, intestinal disorders, celiac disease, colorectal carcinoma, polyp, diverticulosis, diverticulum, diverticulitis, enteritis, ischemic colitis, ileus, irritable bowel syndrome, inflammatory bowel disease, ulcerative colitis, Crohn's disease, intestinal obstructions. about infectious diseases of intestines, of bowels, Clostridium difficile, dysentery, salmonellosis, and the anorectal disorders that at this point are not there. Again, more abbreviations, please check all of them. And well, let's practice on this. You have the most common ones in this chart. I've been reading all of them, previous writing down, previous sending to the group. And let's read. As you can see, it's a lot of information during this specific presentation. I know that the vocabulary is big enough, but let's consider this. It's for our purposes, for our practice. And we have the chance to improve on this. In order, I'm sending you the pool for taking attendance. Please wait a little bit to upload the presentation, okay, to the Zoom chat. We are 16, so I expect 16 answers. Let's go ahead. Okay, the slides are uploading to the Zoom chat. So in order you download it, you send me the usual message telling me yes, or I did, or something like that, to realize that you got this information, okay? Thanks for the poll, it's done. And let's download the slides, the PDF. Can you notice this? Can you check this? No.
Yes, yes.
Okay, perfect.
Yes.
Thank you.
Yes.
In order you download it, please, as Natalia, send me a message to realize that you got it, okay? Perfect. There are 8, 9, perfect. 10. 6 more, please, because I'm not gonna send it by WhatsApp. Perfect. Perfect. 14. Perfect. As soon as you get it, you can leave the Zoom call, the Zoom session. That's okay, because we have everything done. Perfect.
See you, teacher.
See you tomorrow during the workshop. Have a great night. Please, all homework in PDF file. I'm not gonna receive another files, please. This is in the guidelines, and I showed in the first presentation, the welcome presentation. If you send me pictures, a Word file, or something different, I'm not going to take it in count. I'm sorry, it's a rule that we were talking at the beginning. You are still with time to do it, so let's do it, okay?
Good night.
13, okay. Okay. Okay, everything is done. Everything is said. Liz?
Have a good night, teacher. Bye.
Okay. Okay, Gustavo, I'm gonna close this. I'm gonna close the Zoom call. Thank you.